Hello, all. My research proposal is based on the role of art therapy in stress management. Stress is a pervasive challenge, particularly among college students. Research increasingly highlights art therapy's potential as an effective stress management tool. Creative art therapies like visual art, music, and movement have shown promising results. For example, Martin found that 81.1% of studies in their systematic review reported significant stress reduction after CAT interventions. However, the exact mechanisms through which art forms contribute to stress recovery remain unclear. My study aims to explore the mechanisms by comparing the stress-reducing effects of two distinct interventions, art making and art viewing. Efficacy art therapies, as demonstrated by Liu 2024, a 4-week art making intervention significantly reduced stress levels among college students, supporting the broaden and build theory. Ho et al. 2021 found that a 6-week MCAT intervention significantly reduced burnout and improved emotional regulation and quality of life among healthcare workers, with effects lasting up to 12 weeks. While these studies affirm the benefits of art therapy, questions remain about optimal conditions and individual responses to different interventions. My proposed study to address these gaps is a study comparing art making versus art viewing interventions. 100 participants, 50 male and 50 female, will be randomly assigned to one of two groups. Participants will then engage in stress-inducing activities, a math test, and a treadmill walk, followed by a 10-minute cool down using either art making or art viewing. Stress levels will then be measured before and after each session using blood pressure monitoring and self-reported surveys. A perceived stress scale, emotional regulation questionnaires, heart pressure monitors, math tests, treadmill, and art supplies will be the materials included. My analytic plan includes an independent samples t-test to compare the mean stress levels of art making versus art viewing groups. The findings aim to identify which intervention is more effective for stress reduction and provide insights into their mechanisms. In conclusion, the literature supports the efficacy of art therapy in reducing stress and promoting well-being. If this study confirms significant differences between interventions, it could pave the way for tailored art-based programs to help college students and faculty manage stress and prevent burnout. This research not only builds on existing evidence, but also addresses critical gaps, moving us closer to practical, scalable solutions for mental health challenges.